So we're drawing bone marrow from the iliac crest. We'll remove this needle and then we're going to re-prep and drape the patient for the more invasive part of this procedure, which is the discogram. So what we're doing is we're using an extrapedicular approach to enter the discs. And this is the L3-4 disc. And our needles are going to enter just lateral to that facet. We're looking at the facet right here. The facets are the connections between the discs. And we're going to go just to the outside of that in this disc space right here. And that's where our first needle, the introducer, will go in. And that'll be followed by a slimmer, longer needle, which we will direct into the disc space. The reason we use two needles is to prevent infection. The needle that goes into the disc never touches the skin, decreasing significantly the chance of contamination. Because she's a small woman, we don't have to go very far with this. And now we're going to take our main needle and we're going to insert it through this introducer and into the disc. Now I can already feel the consistency of this changing, which means I am in that disc. And you're going to see this now on the screen. You see the small needle going through, and it is in that disc. And I like that. So we're good to go up one level now. And I'm going to be injecting more local anesthetic. And then we're going to be doing the next level. And it's precisely the same way we did the level below. We start with the introducer needle once again. And now we're going to be looking for the position of this needle. And I'm trusting that we're going to have a good spot. And as soon as we confirm needle position in this plane, provided it looks like it's in the middle of the disc and in the nucleus of the disc, which is our intended target, we will move on. Looks perfect. Okay, let's move on to L12. We're going to be injecting local anesthesia again. What I'm doing here is repetitive, obviously. The technique is what's most important, and that is all with the idea of doing no harm and making sure that the needles are in an appropriate position to deliver stem cells into the nucleus. If we can do that, we've done our job. And then the goal is to have those stem cells do theirs. I'm bending these needles ever so slightly so I can steer them. We really don't need much in the way of a turn on these needles. That's because of the obliquity with which I'm entering the disc space. Should be going right towards the nucleus. You notice there's a little bend on these needles as they enter, and that's because these discs are really quite narrow. Lateral, please. And as a result, I have to do a little maneuvering of the needle in order to get them into the disc space and into the nucleus. Good. Last one, T12L1. When we come back to the AP on this one, you're going to notice ribs now. And one more injection local. You'll notice I give some subcutaneously and then a deeper injection along the track of the needle. This is to reduce the discomfort to her at the end of the procedure. Now the stem cells have already been delivered and they are now on the field. And shortly after I finish this, we'll be injecting. And we are going to place this last needle and we are done. You'll notice that we put a banded bag over the fluoroscopy unit, and that's to prevent contamination from my hands passing into the field. We do that all with the idea of reducing any chance of contamination. Good, we're good there. All right, we're done. So what we're going to be doing now is injecting stem cells. They're in tuberculin syringes to make it easy for me to quantitate the amount I'm giving. Because L3-4 is a very degenerated disc with a bulge and active bone marrow inflammation, I'm going to be very careful about volume here because I don't want to blow this disc up and cause a protrusion that would perhaps cause nerve irritation. So I'm only putting in approximately 0.6 mLs, and that is done. We're going to go back now to L23, which is also one of the more degenerated discs. You will now see it as the lowest one of the 3 remaining needles, and we're going to be injecting 0.4 mLs and at the most another 0.3 to make a total of 0.7 mLs. Again, I would rather err on the side of conservative rather than cause the patient any harm here. Now we're going to L12, which is the lower of the 2 remaining disc needles. And we're going to inject 0.6 mLs from this disc, from this tuberculin syringe, and at the most, another couple. I'm not meeting any significant resistance or back pressure. You can see a little bit coming out of the needle, but that's acceptable. And now we're going to T12L1, which is the final remaining needle. And this is a significantly degenerated disc. And we are about to inject here. Again, no significant resistance. And we're going to inject perhaps another 0.3 mLs. We are now done. All the needles are out. This patient is finished with her procedure.